Into the Fold is a podcast on mental health issues, produced by the Hogg Foundation for Mental Health. I'm your host, Ike Evans.
You know, it's been long known that people interact differently with parks and green space, but it has an impact on their health, whether they're running or walking or using it to gather or gardening or fishing. It just has all of these health benefits. And so I think when we look at those historic investments in parks, in green space, when we look at disproportionate placement of dumping sites locally, we have to really think about how is that impacting the health of those communities. When we look at the health disparities, we have to also look at what have been the investments in those communities. So in Houston, there's the health department has data that shows it used to be almost a Y pattern that followed the freeway system. And now it's kind of changed to what they call an inverted C or arrow pattern. And there's just certain communities, you know, across the north end of the city, down the eastern corridor, and then in the southern portion of the city, and then a little bit toward Fort Bend and Gulfton and Ailey, that are communities that just struggle. And we also know that those are communities that have less trees, they have less large parks, and that you have to start looking at how that correlates to health outcomes.
For us, it was at a really nice moment that Jennifer Boley came to us with the idea for healthy outdoor communities. And it's a collaborative approach to park access and equity in communities. And we ended up landing on Third Ward and Acres Homes as the space we would work on, well, hopefully work on first, but it would be the focus of healthy outdoor communities as it is now. Those are both communities that are along Bayou Greenways, and they have a lot of great park opportunities. And they're both in the original 5 complete communities. So we knew we could rely on existing data that was there about health disparities, about what the community is looking for in terms of parks, but in terms of a lot of different things: walkability, access to healthy food, education, a lot of the things that we know it will take to get to a healthy community.